The on-site oral 5 comprises of a cylindrical test chamber with a clear results window, an oral fluid collection swab with a liquid tight seal. When performing an oral fluid test, always keep the procedure card handy for reference. Before use, ensure the test is at room temperature, between 2 and 30 degrees Celsius. Record the lot number and check the expiry date is still valid. The expiry date format is year, month, day, so be certain to read it correctly. Never use a test past its expiry date because the results may not be accurate. Before opening the test pouch, check it for holes, cuts or any damage. The test must be airtight or it will dry out and no longer provide accurate results. Tear open the pouch. Remove the on-site oral 5 test. Always wear gloves when handling the test to prevent contamination. An important note: nothing must be consumed by the donor in the 10 minutes prior to testing. This includes water, food, drink, chewing gum, cigarettes or anything else. Give the test to the donor. Instruct the donor to remove the plastic protection from the swab. Direct the donor to place the swab in their mouth. The donor must wipe the swab under the tongue and around the sides of the cheeks. Finally, placing the swab under the tongue until a full 3 minutes has passed. Failure to collect sufficient saliva can cause the test not to work correctly and result in the test needing to be repeated. Wait a full 3 minutes to collect as much saliva as possible. 1 to 2 mL is required for this test. Place the test chamber on a flat surface and insert the test swab. Check the swab is sufficiently full of saliva. It should feel like a soft marshmallow. Insert the swab directly into the test chamber. Then screw down the lid to compress the sponge. Remove the privacy strip to reveal the results. The saliva will immediately begin to run up the test strips. The first line to appear will be the test line. The presence of this line indicates a negative result. The absence of this line indicates a presumptive positive result. Each test strip will look a purple colour while it is reacting with the saliva. Within 5 minutes, a second line will appear on each strip called the control line. The control line is a procedural control. It indicates sufficient saliva collection, adequate wicking and validates the test. The test and control lines may be of varying darkness, but this does not indicate anything unusual. Any hint of a line is considered a line. This is very important to keep in mind when interpreting the test. To get a clearer image of the results, let's look at this image. A negative result is indicated by 2 lines, a control line and a test line, irrespective of the darkness of the colour. A positive result is indicated by the control line only appearing and no test line appearing. An invalid result is where the control line fails to appear, whether the test line appears or not. Read the results once all control lines have appeared. If a control line fails to appear, the test is invalid and you will need to repeat the test. The results of this test indicate no drugs are present. Each colour-coded test strip has both a test line and control line present. Each colour indicates a different drug for ease of recognition. An important note: interpret the results once all control lines have appeared or 10 minutes after sample collection. Never interpret the results after 1 hour because the test strips start to dry and the results can alter. The on-site oral 5 is a screening test only. Any presumptive positive results should be confirmed by a laboratory using LC-MS testing.